What are you going to learn in this training? So I have created the PPT based on the chapters. So first we will start with integumentary system. So what do you learn in integumentary system? So mostly you will learn biopsy and fine needle aspiration and core needle biopsy. So basically in live training, you will learn how to identify fine needle aspiration and core needle biopsy, and how to identify how does the patient will send samples to cytology or histopathology. So how to differentiate basically. What is the difference between FNA as well as core needle biopsy? Okay. Next, debridement. So here you will learn what are the types of debridement. So how to identify skin level debridement and which codes you will use for skin level debridement. And next you have soft tissue debridement. So how do you code soft tissue debridements? And if you have multiple wounds, how to code debridement. Okay. Next you will learn skin biopsies. So which is one of the most important topic for interviews also. So skin biopsies and types of skin biopsies, how to code multiple skin biopsies, and what is the hierarchy of skin biopsies. Okay. Next you will learn lesion excision versus shaving. Okay. So lesion excision includes benign and malignant lesions. So how to identify benign lesions and how to identify malignant lesion excisions. Okay. And also you will learn what is the difference between excision and shaving. Why means both are same. Both are different. Excision is different, shaving is different. Sometimes in OP reports you can't identify how to differentiate these two. So that you will learn using the live charts. Okay. Next, you will learn wound repairs. So usually we'll call it as closures. So how to identify simple repair, intermediate repair, as well as complex repair. Okay. Then you will learn how to code if the patient has performs two repairs like complex and intermediate repair. Which one we need to take code or we need to take first, either complex or intermediate repair. In what situation you will use two repair codes and what situation you need to use only one code. Okay. Next, adjacent tissue transfer or rearrangement. So this is very important for ambulatory surgery coders. So what are the keywords you need to identify in the operative report? Okay. So if you understand those keywords, you can understand this adjacent tissue transfer. So basically you will learn what is adjacent tissue transfer. Okay. So basically adjacent means nearby. So local tissue transfer near to the wound area. So that you will call it as adjacent tissue transfer. So what are the keywords you need to identify in the operative report for ATT coding? Okay. Next, skin grafting. So here you will learn like what is split thickness graft, what is full thickness graft, and how to identify the graft using the operative report. Okay. And along with that, you will learn skin substitute grafts. So what is the difference between skin grafting and skin substitute grafting? So all those basics you will learn during this training. So why means these are very important for your interviews also. Okay. Next, most micrographic surgery. So here you will learn most important interview topics related to most micrographic surgery, and you will learn what is the purpose of most micrographic surgery. Okay. So how do you code if the single patient performs both surgery as well as the pathology? So how do you code the two different patient performs most surgery as well as like pathologist? Okay. Next, most importantly, from integumentary system, you will code breast procedures. Okay. Breast procedures are very important. Here you will learn how to code benign lesion excisions. Okay. So how to code radiology related procedure, how to code breast biopsy procedure, how to code mastectomy. So which is the very important concept for your interviews. Okay. After mastectomy, you will learn reconstruction procedures. Okay. So what is the difference between tissue expander as well as permanent implant? Okay. So what are the guidelines related to reconstruction? What is tram flap? What is free tram flap? What is epigastric flap? So all those things you will learn during the breast procedures. Most importantly, breast procedures, we have few codes. So what is the difference between breast lesion excision as well as mastectomy? So these are very important. So you need to understand for interviews as well as live coding also. So these are the keywords you will learn during our breast procedure training in the integumentary system. So these are the very important topic you will learn in from the integumentary system coding. Okay. So next one is musculoskeletal system. So here excision of musculoskeletal tumors. 100% you will call lipoma excisions from musculoskeletal system. Okay. So how to code lipoma excisions? Okay. So what is the hierarchy for lipoma excisions? So whenever you want to code excisions, you need to check the depth of the tissue removed, whether it is subcutaneous layer, whether it is muscle or fascia layer or bone level. Okay. Or radical resection of lipoma. So you will learn how to identify those layers. So when to code subcutaneous level soft tissue lipoma excision and when to code muscle level lipoma excisions. Okay. In excision of musculoskeletal tumors, 100% you will get these tumors lipoma excisions in the live coding. You will learn all those keywords here. Okay. Next, fractures and dislocation. So first we will learn here what is the difference between fracture and dislocation. Okay. And how to identify the fracture, whether it is fracture or whether it is dislocation. So how to code both fracture and dislocation in the same anatomical area. Okay. What are the types of fractures? What are the types of treatment like open treatment, percutaneous treatment and closure treatment? So how to code closure treatment, how to code percutaneous treatment and how to code open treatment of fractures. This differentiation is very important if you want to go to interview as well as in live coding. If you understand key concept where to start, you can code any chart in easy way. Okay. So in fractures, we will learn the anatomy also. So first we will learn the anatomy. Next we will learn the CPT course related to fractures and dislocations. Okay. Next, arthroplasty. So other name for arthroplasty is replacement. Okay. So here most of the time 100% in the live coding, you will get two types of replacements. One is knee replacement, another one is hip replacement. These two frequently you will encounter. So you will learn all those replacement and how to identify components in the knee replacements as well as how to code these hip replacement procedures. So if you want to code hip replacement, you have multiple variations. Okay, so those things you will learn during the arthroplasty training. Next we have injections, aspirations and trigger points. Okay, so now you will learn injections or joint injections. Like in the CPT coding, you will see it as arthrosynthesis. Okay, here you will learn this injection based on the joint, small joint, medium joint and large joint. So those you will learn here, and also you will learn when to code injection, when to code aspiration. Okay, whether you can code both injection and aspiration in same location or not, you will learn during our live coding. Okay, next you will understand trigger points. So this is one important topics in the ambulatory surgery coding, trigger points. How to code trigger points, this you will learn. Next, spine and spinal fusion, so which is the very tough and complicated topic in the musculoskeletal system, but in our training you will learn it using very easy way. Okay, so here I will teach you. So spinal fusion, what is spinal fusion, what are the approaches, so how to code bone graft, how to code instrumentation, how to code cages, all those comes under spine and spinal fusion. Okay, next, arthroscopic joint procedure. These are very important in ambulatory surgery coding. 100% you need to code arthroscopic joint procedures. Okay, for example, if you take carpal tunnel syndrome, so we have open procedure as well as arthroscopic or endoscopy procedure. So how to differentiate whether it is open procedure or endoscopic procedure? Those things you will learn during the arthroscopic joint procedure. Mostly from the arthroscopic joint procedure, you need to understand like carpal tunnel release, knee arthroscopy, shoulder arthroscopy and hip arthroscopy. 100% you need to code shoulder arthroscopy as well as knee arthroscopy. Those two joints you need to master if you want to work in ambulatory surgery coding. So all these things you will learn during our live coding. Okay. Next, from the respiratory system coding, you will learn nasal endoscopy and sinus surgery. Okay, so here you will learn ethmoidectomy combination codes. So we have multiple combinations in ethmoidectomy surgery. How to code ethmoidectomy combination. Okay, so this comes under sinus surgery. Next, you can understand laryngoscopy. So what is the difference between direct versus indirect laryngoscopy? So this is very important for your interviews also. So if you go to interview, they will ask you what is the difference between direct and indirect. So these basics you will learn during our live training. Next is bronchoscopy. Okay. So if you go to interview, they will ask you what is the difference between laryngoscopy and bronchoscopy. So those differences we can learn during our live training. Okay. So how to code multiple procedures using the bronchoscopy. Okay. How to code lymph nodes using the bronchoscopy. Okay. Next, you will learn how to use navigation. So while performing the bronchoscopy, physician will use the navigation or computer assisted navigation. How do you code that one? Okay. Next, you will learn thoracentesis. Okay. So these things you will learn from the respiratory system coding. Why means 100% you will get these three topics: nasal endoscopy and sinus surgery, laryngoscopy, bronchoscopy. 100% you will get all these three. So you will learn in an easy way. Okay. Next, cardiovascular system coding. So this is also like musculoskeletal system, one of the most complicated topic. Most of the coders will get confused here. So here during our live training, you will learn what is the difference between selective and non-selective catheter placement. Okay. So selective and non-selective catheter placement. How to identify selective and non-selective catheter placement? This is very important interview topic. Selective and non-selective catheter placement, that I will teach you. Next, component coding, surgical versus radiological. So here you will learn when to code single code and when to code multiple codes related to cardiovascular system coding, or mostly codes related to 30,000 series. Okay. Next, you will learn CABG procedure. So the other name for CABG is coronary artery bypass graft. So first we will learn what is the medical necessity for CABG. Okay, how to code if the patient uses only arteries for CABG, how to code if the patient uses only veins for CABG, then how to code if the patient uses both arteries and veins for CABG. So those basics we will learn here. Next, pacemakers and implantable defibrillators. So this is also very important topic for interviews basically. Okay, so here you will learn what are the components of pacemakers. Okay, so what is the difference between pacemaker and AICD? Usually implantable defibrillator you will call it as AICD. Okay, so what is the difference between these two? Okay, and codes related to pacemakers and implantable defibrillators. And most importantly, this one, lower extremity revascularization. This is very important topic for interviews, and which is very complicated topic. Okay, so during this lower extremity revascularization, you will learn what are the vascular families. Okay, what is the straightforward lesion, what is the complex lesion. Okay, and how do you code if the patient performs procedure in multiple vessels. Okay, so what is the difference between angioplasty, atherectomy, stent insertion and thrombectomy? Okay, all those procedures you will learn here. And also here you will learn dialysis circuit interventions. Okay, like AV fistula and AV graft. These are very important for interviews. So if you go to interview, they will ask you what is the difference between AV fistula and AV graft. Okay, so those basics you will learn during our live training. Okay, so next one, digestive system coding. So here in endoscopy, most importantly live coding, you will code EGD, sigmoidoscopy and colonoscopy. Okay, so when do we use EGD? So what is the medical necessity for EGD? When do you use sigmoidoscopy or colonoscopy? So how to differentiate whether physician has performed sigmoidoscopy or colonoscopy? What are the landmarks you need to find in the operative report in order to code EGD, sigmoidoscopy as well as colonoscopy? Okay, here you will see, like most importantly, if you go to interview, they will ask EMR, endoscopic mucosal resection. So what is the important criteria for endoscopic mucosal resection? That you will learn during our endoscopy procedures like sigmoidoscopy, colonoscopy. Okay, and you will learn how to code multiple polyps. Okay, so these techniques you will learn. Next, importantly, hernia repairs. So hernia repairs also 100% you will get in the ambulatory surgery coding. So here you will learn what are the types of hernias. Okay, so what is the difference between initial versus recurrent? What is the difference between reduced versus incarcerated? Okay, so what is the difference between open approach, laparoscopic approach, robotic approach? So how to identify laparoscopic approach? How to identify open approach? How to identify robotic approach? So basically these are the keywords I will teach you during the live coding. Okay. Lastly here, endoscopic retrograde cholangiopancreatography, usually we'll call it as ERCP. Okay. So you will learn ERCP also. So this is one of the important topics you need to understand for interviews. So if you go to interview, they will ask you, what is the meaning of ERCP? And how to code if the patient inserts multiple stents. Okay. So like those ERCP basics as well as how to code multiple stents, like removals as well as replacements. Okay, and also sometimes you will see colectomy procedures. Mostly we will not code colectomy in ambulatory surgery coding, but interview purpose those are very important. You will learn colectomy procedures and also you will learn bariatric surgery procedures. Okay, like sleeve gastrectomy. Okay, Nissen fundoplication. So if you go to interview, they will ask you, what is Nissen fundoplication? What is the purpose of this? So those things I will teach you. So these are the very important questions which I have procured from our previous students. Okay. So these are the things you will learn from digestive system code.
Sorry.
Yeah, go ahead. Yeah, go ahead. So next, urinary system coding. So in urinary system, cystourethroskopy is very important. Okay. So here we will learn cystourethroskopy guidelines. Next, we will learn endoscopic treatment of bladder tumors. So like fulguration or resection. Here you will learn how to code multiple like kidney stones removal or bladder stones removal. Okay. Next, kidney and urethral stone management like lithotripsy. All those things you will learn here. ESWL. All those things you will learn from urinary system coding. Next, you will learn indwelling urethral stents. Insertion versus removal. Okay. So how to code these urethral stents? So what is double J stent? Okay, all those things you will learn from urinary system coding. So next one, male genital system. So here you will learn lesion restriction versus excision. So how to differentiate restriction versus excision? So basically you will learn this lesion restriction versus excision you will find in each and every anatomical area. Okay. Next, what is circumcision? So what are the variants of circumcision procedure? Okay, so how to identify initial circumcision or repeat circumcision? Okay, next, hydrocele and varicocele repairs. So here you will learn what is the difference between hydrocele and varicocele and what are the core differences. Okay, so next, archaeopexy versus archaeectomy. So what is archaeopexy and what is archaeectomy? You will learn these basics. Next, prostatectomies. These are very important. So mostly you need to understand prostate biopsies. These we have from 2026 latest guidelines. So here you will learn how to code prostate biopsies. These are very important. Okay. So that I will teach you. So how to identify prostate biopsy based on code description. Okay. Next we have female genital system coding. So first we will learn vulvectomy. Okay, so like simple vulvectomy, partial vulvectomy, complete vulvectomy, how to differentiate these types of vulvectomy. Okay, next biopsies of vulva, vagina and cervix. Okay, next you will learn LEAP procedure, loop electrosurgical excision. Usually you will call it as LEAP. Okay, next most importantly here you need to understand hysterectomy guidelines. Okay, so how to differentiate laparoscopic approach, open approach, as well as therapeutic approach. Okay, you how to identify whether it is total hysterectomy or supracervical hysterectomy. How to identify using the operative report. Okay, so that I will teach you. Next, we will learn pelvic floor repairs like colporrhaphy. So we have multiple types of colporrhaphies: anterior colporrhaphy, posterior colporrhaphy, and combination both anterior and posterior colporrhaphy. Okay, so when do you use anterior colporrhaphy? When do you use posterior colporrhaphy? Or when do you use both anterior and posterior colporrhaphies? So using these pelvic floor repairs, we will let colporrhaphy. Okay. Next, we have OB-GYN coding. So here you will learn global obstetrical package. So what are included in global obstetric package and how to code component coding. Okay. So what is the VBAC coding? Okay. VBAC means basically vaginal birth after cesarean delivery. Okay. Next, what is the difference between induced, spontaneous, missed, and threatened abortions as well as their coding? From OB-GYN coding we will learn. Okay. Next one is most importantly nervous system coding. Okay. So here you will learn injection, drainage, aspiration of the spine. Most of the time these are for pain management. Okay. So like what do you call like ESI, epidural steroid injection, and transforaminal epidural steroid injections. Okay. And we will not code these craniectomy procedures, but sometimes we will code craniotomy procedures, which we will learn here. And most importantly, spine and spinal cord procedures like laminectomy and laminotomy. Okay. So how to differentiate laminectomy and laminotomy? So what is hemilaminectomy? So when do we code these 6000 series codes along with 2000 series codes? Sorry, 20,000 series codes. Okay. Next, neurostimulators. Okay. So here we will learn what are the components of neurostimulators. Okay. What are the types of neurostimulator? So basically we have four types of neurostimulator: gastric neurostimulator, spinal neurostimulator, deep brain neurostimulator, as well as peripheral neurostimulator. So we will learn all those types of neurostimulators. Okay. So how to code radio frequency ablations. Okay. And as we have discussed previously, we will learn carpal tunnel release. In 60,000 series, we will learn open procedure of carpal tunnel release. Okay. In 20,000 series, you will get code for endoscopic release of carpal tunnel and peripheral nerve repairs. Okay. So here you will learn what is nerve graft, what is the conduit, what are the strands related to peripheral nervous system. Okay. So and also along with you will learn procedures related to eye and ear like cataracts. Okay. What is extracapsular cataract? What is intracapsular cataract? Okay. From the ear section, you will learn what is like tympanostomy and what is mastoidectomy, what is TARP, what is PARP. So all those things you will learn from the ear section of the this training. Okay. Next, along with that, you will learn all these fundamentals. So introduction to CPT surgery section, like you will learn guidelines and layout. Okay. Next, you will learn surgical concept like global periods, include versus separately reportable services. And you will learn all modifiers and you will learn general surgery concept. Okay. And also you will learn plastic surgery. Okay. So these are the final things. So first you will learn NCCI edits. Okay. So how to code and how to check if we have multiple CPT codes. So how to decide which code to you need you need to finalize if you have like multiple codes more than 2. So you will learn common surgical instruments. Okay. Next you will learn types of incisions, surgical positions. So one means based on position you need to identify the procedure. Next, OP report components. So what is the typical live chart related to OP report? Okay. So how to choose keywords from OP reports? How to lead index? Okay. Next, most of the time we will use codifying during our training. Okay. Next, live chats. Along with this theory training, you will learn 40 to 45 chats, live chats. Okay, and also approximately you will learn 1500 very important Q&A for interviews. Okay, so and also you will learn CPT updates for interviews. So why means if you go to interview, they will ask you what are the latest CPT coding like updates from 2026, that you will learn. And also we will provide job assistance in India, UAE and USA. Okay, so if anyone interested to join this training, you can send message to 707-526-3939 for registration.